Let's welcome Dr. Clay Flores.
Dr. Clay Flores, they're here. It's time.
Okay, here. Thank you. What if I told you that every time someone speaks to me, this is what I hear? Happy birthday. Good morning. What you doing? Would you send me to the principal's office to get swats? Would you start yelling insults at me in front of my classmates? What if I told you that every time the lights came on, this is what I saw? The spotlight, the reflection off the whiteboard. Would you make fun of me? Would you try to flash lights at me? Would you avoid sitting with me on the recess playground? Or what if I told you that every time I'm in front of people, this is what I feel? What would you do? Would you call security on me, the school security? Would you end my job interview prematurely and say, "Thank you for coming in," and run away? I'm going to share with you a little bit about my background that you already heard. I started out as a missionary kid, and I always had a backpack because I was in a self-directed homeschool. And I thought my mom made up that term, self-directed learning. And then when I started applying to medical school, medical schools use that too. And I wonder if nursing programs have self-directed learning programs. But I learned with my backpack full of art supplies traveling around Mexico, I learned about a variety of culture and language. When I got to high school, I got my first glimpse of how people with special needs are treated. They were relegated to the side of the playground to sit in the bleachers while all the other kids played. They were bullied. They were made fun of. When I went to Duke, I had friends in the math and engineering department, and I noticed that some of them would laugh at the wrong time in a joke. Some of them would make odd eye contact, maybe at an angle or with a little rocking movement. And I continued my pre-med volunteer work in the community by volunteering at nursing homes and also working with paraplegics. Then I got to Rutgers Medical School, and here I experienced something new. It's called burnout. All of a sudden, I was required to be a pathologist, a biochemist, an anatomist, and even a patient transport expert, pushing patients around the hospital in a wheelchair, going to the wrong places, getting on the elevator. Being burned out is like a hat rack. If you have one hat, two hats, it's okay, but you start piling on more hats, that's when you get to burnout. Fortunately, I had my missionary background that allowed me a release where I could volunteer in the inner city, and on my vacations, I could return to traveling to Mexico on missionary trips. Then I graduated and finished all my training, and I started a busy practice in Texas. And in addition to the busy practice, I was the administrator of the practice, the office manager, the HR director, and I was doing tons of circumcisions because I love procedures, and other doctors found out, so they sent me all their circumcisions, and I started feeling burnout again. There was a need for hours dedicated to persons with special needs, so I added that to my load of responsibilities. My burnout didn't get better. And then came to town an international pediatric rehabilitation program, and they needed a pediatrician, so they started recruiting. And after about 6 months of going to lunches and hearing the speeches and looking at reviews from other countries where they served, I said, great, I'm selling my practice, I'm going to be full-time special needs pediatrics. And I loved it. I was on a team with neurologists, PM&R, nurses, nutritionists, every single therapist I didn't even know existed, like aquatic therapy, play therapy. It was so much fun. Autism needs became more obvious to me because our patients, our rehab patients, they would show up with red flags indicating autism. And when we tried to send them to get tested, to get assessed, you know what happened. You all know what happened. Years and years on the wait list. And if they were 3 years on the wait list and this clinic only saw them up to 6, they would turn 7 before their turn came. And once they got seen, then it was still confusion. Okay, what do we do next? So I started to supplement those needs diagnostically. I started to spend more time with the autism community. And then came along Mr. Pandemic, right? With his wife, Miss Corona. And this magnified the needs of autism. You already know about the long wait list, right? So now imagine what happens when all the clinics shut down, including the clinic I was working at. But I was determined to continue the focus on the needs for autism. So I developed, with materials provided by the generosity of Vanderbilt Autism Program, I developed an online autism diagnosis and assessment program, which kind of was the baby or the grandfather of Flash. And I was able to continue seeing patients online for autism needs during the pandemic. But working for a charitable organization and a pandemic, the donations declined, which resulted in my salary declining. So I continued working pro bono, but then I took on an urgent care job at night to pay the bills, and guess what happened? Burnout. Then I found the best burnout treatment ever. Oklahoma. Who would have thought? Before I came here, my friends and medical colleagues said, Oklahoma? They started putting out headlines and articles, and I was like, I don't care. I need something. So I came to Oklahoma, and the greenery, the cattle, the winding roads, the amazing sunsets and angry clouds, the emotion in the sky was great. I had more time. Instead of 2-3 hours in the car a day driving around the hospitals and being in traffic jams, I could get to work in 5 minutes and get home in 5 minutes. I got home and it was still sun up. I thought Oklahoma invented new hours or something. So I had family time. And then the demand for my passion was welcomed with autism. Everybody I met was collaborator friendly. Every door I knocked on, every clinic I went to. If I saw somebody with scrubs in the grocery store, I was behind them in line talking about autism. And everybody was welcoming and willing to collaborate. I currently collaborate with Fundamentals Pediatric Therapy Center in Ardmore, where I come in, use one of their rooms, do my autism thing, and then I have 50, 100 therapists around me, and I can just run out the room and ask a question about speech. I can run out down the hall and ask somebody about occupational therapy. It's amazing. So, Future Leaders Are Spectrum Heroes focuses on timely and thorough diagnosis for kids, but it also focuses on when those kids grow up. Kids with autism grow up, and they need jobs. Just for today and just for you, and especially that table right there that helped me relax by telling me awesome jokes, I'm changing my program to Lash, only for today. My assistant, Cannon, is going to come out here. Cannon, please take out that L, please. Take that L. I'm changing the name. And, Cannon, I'm sorry. Take out the F. The F, sorry. I can't, okay. I actually should say just take it off the stage instead of take it out. Just take it off the stage. Thank you. This is my assistant, Cannon. So it's gonna be today and just for you, it's Lash. Leaders are future heroes. Leaders, you are leaders. I'm looking at you, and all I see is leaders. Why are you leaders? Because of your history, because of your service to Oklahomans, your collection of diplomas, which you probably have in your pocket in miniature, or you have it on your walls, and the way you grant medical access to your patients. I know that patients come to you and they have no concept of time. The appointment's at 10, what time they show up? 10:45. I know that patients come to their appointment with 5 kids, and all of them are missing their nap, and all of them are hungry. But you make medical care accessible to them. So you're leaders. You're also heroes, and you're heroes in the now. That's why I removed the future. You already are heroes. You are heroes for people with autism. I personally want to take this up. Thank you for holding my hand these past 20-some years of medical training. From medical school to residency, every time I enter a new medical environment, a new hospital, a new clinic, guess who's spending time with me, pulling up a chair, showing me the shortcuts on the EHR, telling me what not to order in the cafeteria, sharing your special color pens to highlight certain things. And all I have to do is go like this and mention how long it's been since I've eaten or had sleep being on call, and you all would pull out an array of snacks. And I could pick from any snack to keep me going the next few hours. So reach over, pat a nurse on the back, and tell them Dr. Clay Flores appreciates them. Yes, do it. Very good. Very good. So what are my presentation goals? I want to go over first kids with autism, because I started out as a pediatrician. And I'm going to go over causes, diagnosis, and treatment. Then I want to go into adults with autism, which is the other half of my program, of my entity, the long-term effects, as well as the bare essentials. And while I'm doing this, I'm going to provide nurse hero tools for you to use. Nurse hero tools that, thank you, Canon. Yes, tools similar to this, but not exactly these tools. Let me ask you this. How many of you, either when you were in nursing school or you started your career or even now sitting next to you on the chair, have a special nurse pouch with your pens and your markers? Anybody relate to that? Or another pouch that was for your snacks that you would share with the hungry residents. So every time you hear me say, pouch please, I want you to perk your ears up and pay attention. Because I know we just had lunch, so I don't mind if you take a nap and digest. But when you hear pouch please, I want you to pay attention. Here's the first one for practice. Pouch please. Remember, modern medicine could not exist without you. It couldn't. Maybe 100 years ago, when I had my practice in a room behind my barn, or I was on a wagon going town to town, but now modern medicine cannot exist without you. Pouch please. Look for burnout in yourself, in your colleagues, and in your patients, especially the ones with autism. Okay, kids with autism. Pouch please. Make your exam room autism friendly. Have things that aren't expensive. Don't have your art collection in your exam room. Don't have your leather binder out on your desk, okay? Have some toys that don't make noise, because you won't get anything done. Silent toys that spin and maybe have little fidget devices on them. Make your exam room friendly for autism. What is the cause of ASD? Autism spectrum, what's the D stand for? Disorder. If it were autism spectrum disease, then we would know what the cause is, right? But it's disorder because we don't know what the cause is. When I review the literature, every time I'm giving a presentation or every time I'm just having a hard time falling asleep and I review the literature to see, let's see, what's the cause of autism? There's not a definite root cause. And to ease my brain pain in looking at all the literature and the research, I divide autism cause into two categories. Number one, DNA factor, and number two, the stress factor, okay? So first, the DNA. You all know what DNA is. I'm not going to explain to you what DNA is, but it is the blueprint, and with that blueprint, it results in the anatomy. Everything you see, the beautiful array of people and color and hair and arms and legs I see right here is DNA, as well as autism. So the literature is highly convincing, and the research, that DNA is associated with autism. And there are a few theories. The first one is overproduction. DNA results in each neuron having more connections than it normally does. A normal person has 1,000 connections on one neuron. In autism, they're finding 2, 3, 4 times as many connections on one neuron. There's also a lot of literature supporting overgrowth of the cerebral cortex, as well as dysfunction and malformation of neurotransmitters. All of these are convincing. But I want to focus on just one today that I find very understandable, and it helps to relate to the symptoms that we see in autism. Doctors or researchers such as Dr. O and Dr. Caroline Robertson out of Dartmouth, they put forth this study with the technology now that the autistic brain does not have long-distance connections. The brain has to connect universally, the front of the brain with the back of the brain, each side to side. And they are finding that in the normal brain, let's take an example. A baby has the back of the brain for vision, the occipital lobe, the front of the brain for decision making, the hindbrain cerebellum for balance. So all of those have to unite and communicate with each other for a baby to start navigating and negotiating the simple task of raising their head, sitting up, climbing on a step. In autism, they're finding, with the amazing radiologic technology, that when they study the connections between brain cells, in autism, the brain cells only connect, or majority connect, just with their neighbor cells. So all the brain cells in the back with vision, they just connect with other vision cells. Doesn't that make sense when you find children with autism or adults that are focusing only on certain things? They'll come in this room and they won't notice the people, they won't notice the handsome doctor, they'll just notice that little tiny light up there in the corner. Because the brain's not connecting the whole environment to put a picture of a social context or a problem-solving situation. So this is amazing. The next category that helps me understand and categorize is the stress. Studies have been done for decades. A key study was done by Cheeve in 2014, but it shows, and it has been shown over and over again, that low birth weight, prematurity, and C-section highly associated with the diagnosis of autism. Those right there, for medical specialists, should translate directly to stress. And then if you look at what causes these problems, drugs, smoking, alcohol, poverty, abuse, those are all forms of stress. And the literature supports and points out that this is a big cause of autism. So, pouch please, don't worry about the etiology, just focus on, I'll tell you later. Pouch please, what causes autism? If you're asked this, we don't know yet. That's the answer. But we know that early intervention is the best. Pouch please, do you think she has autism? What are you going to answer? Instead of guessing, she deserves a thorough, accurate diagnosis. Okay, break time. Where's my assistant, Cannon? Who here can show me a picture of your FFFF, your furry, fluffy, favorite friend? Show me a picture. You got to show me a picture on your phone. Oh, there's one. Cannon, take that lady a prize, please. Who else has one? All right, over here. So right there in the back, Cannon, all the way in the back. I saw her hand. Okay, pouch, please. All the statistics are worse than reported. thanks to COVID disrupting surveillance. Every statistic you read now is 2, 3, 4 years off. So everything you see and everything I show you, it's worse. In 1960s, 1 in 2,000 kids had autism. In 2020, 1 in 36. The ratio is 1 girl to every 4 boys. In my practice, I calculated this last year, it's 1 to 1. The average intervention time is way past the critical window of 3 years old, 4, 5, 6 years old. This study in Sweden shows they looked at 20,000 youth, 7,000 were females, and they looked at these young people with psychiatric admissions to hospitals. And if we zoom in, we see the blue lines represent autism, boys and girls. And which one's the girls? The taller one. Girls with autism, 2, 3, 4 times more likely to have comorbidity with psychiatric problems and diagnoses than boys. Pouch, please. Suspect autism with any girl that has any psychiatric symptom, whether it's chronic or whether it's short-term. Let's talk about diagnosis. Pediatricians use the MCHAT and they're screening all their kids 81% of the time. Only 50% of us are doing it correctly, and only 30% of us refer them on if we find a red flag. Okay? Pouch, please. Use your nurse superpowers to fill the cracks left by doctors. Please. Let's look at the diagnosis. Multidisciplinary teams. Where do you find multidisciplinary teams? A neurologist, a behavioral analyst, a developmental pediatrician, all in the same team. Where do you find that? In your clinic? Down the street? Where do you find those? Universities. Multidisciplinary teams are very accurate and good at diagnosing. If they compare those diagnoses to an individual diagnostician, there's 89% agreement. That's reassuring for me. I'll keep doing what I'm doing. Who's better at diagnosing autism? It depends on the knowledge that the diagnostician has. It depends on their training and their culture. Research indicates internationally that there are still medical professionals that feel autism is caused by witchcraft or some curse on the family, the kid's spoiled, or the parents are cold. Why experience counts? Experience counts because autism is not always straightforward. There is present but not seen autism, okay? Present but not seen. What does that mean? The symptoms are present but they're not seen. This happens with compensation and masking. Then you have seen but not present. This happens with look-alike syndromes. Syndromes of genetic origin, of endocrinologic origin, can imitate autism. Why doctors don't diagnose? Why do kids see doctors and they have a suspicion and then they put them on this 3, 4, 5 year waiting list? The research, the studies, the meta-analysis indicate no one wants to say the A word, autism. Doctors, nurses, parents. There's also a labyrinth. It's confusing anytime you talk about autism, especially if you throw in insurance companies. Especially if you throw in the next one, provider disempowerment. You are disempowered to diagnose autism. Nurses are not, a nurse diagnosis is not accepted. A nurse practitioner, a PA, an advanced practice nurse. Insurances won't accept your diagnosis, even if you have 20 years of experience and you're using the tools better than 50% that doctors use it. This empowerment stops the diagnosis. And then the emotional investment. I can't tell you how many boxes of Kleenex I go through in my autism clinic. I'd say 75% is for the parents, 25% is for me. Pouch, please. Discover autism services near you. Go knock on their door, ask them what they're doing, how they're doing it. Set your timer for 3 minutes because everybody's busy, and then ask them what you can do for them. Let's go over to treatment. Small, tiny, short opportunity window of 0 to 3 years old. Pouch, please. Remember I said I'd tell you later what to focus on? This is what you focus on in autism. You can listen to this and leave the room and go to sleep and digest, but this is the most important thing. Favorable outcomes depend on early detection and early treatment. 0 to 3 years old. So when we talk about treatment, the goals are speedy results, the results to be long-lasting, and decreased side effects. Any treatment you do, or diagnosis, you're going to have side effects, you're going to have these problems. This study has been done over and over again, and it recently was summarized by Dr. Heffler on an online seminar. But these are the 3 predictors for best outcomes in kids with autism: parent responsiveness, verbal stimulation, and parent play with the child, all before 3 years old. Guess what is the biggest obstacle to these 3 things? Everybody, you have it on your person. It's right next to you. You might have 2 of them. The cell phone. The research indicates that when there is any digital device on, even if you're not looking at the screen, it's just background noise, it's dramatic how all of these decrease and disappear. And when they look at the videos, they've actually put videos in homes, they see the parents do this to the child. Football moves, blocking the child, pushing the child away, and their response is abrupt and harsh. No chance with the social aspect of development. Pouch, please. Turn off the screens. Get your families to turn off the screens. When they come in with a phone, phone's on, baby's there, accidentally spill your coffee on it. Get them to turn off their screens. No, I'm kidding, don't do that. The physical aspect. This is all part of the acronym SPEMS. Social, physical, emotional, mental, and spiritual. This is the physical. Exercise, nutrition, anatomy. I'm not going to tell a nurse, a room of nurses, any details about that. But the literature indicates the dietary habits of people with autism increases free radicals, and oxidative radicals, which affect their emotions. Other studies indicate that exercise is bidirectionally related to your mental health, especially in autism. The more you exercise, the better your mental health. The better your mental health, the more you want to exercise. Pouch, please. In the physical aspect, make sure you confirm vision and hearing and get the wax out of the kids' ears as a first step in the autism process. Okay, the emotional, the E. They have the same emotional mechanisms with stress hormones, relaxation hormones. The studies indicate that any child that has 1 or more adverse childhood events in their life, higher risk of autism. Pouch, please. Suspect autism in any child with adverse child events. Okay? Divorce, death in the family, abuse, out of home placement, drug use, parent goes to prison. All of those are associated with higher risk of autism. Okay, most important thing for the emotional. Attachment theory. This was presented by Dr. Bowlby, British psychiatrist during World War II. He noticed the children that were being removed from their parents to send them to safer places like auntie's farm and uncle's granary or cow pasture away from the city. He noticed the effects it was having on the little children. So he discovered and he proposed and he evidenced, which is always has been used ever since then, attachment is most important for children. This is a child, this is the caregiver. As long as there's strong attachment, the child can go through problems, can hit obstacles, can have lows in their life, highs, they can even go to sleep, they can try new adventures. But as long as there's good attachment, the child always can look out the window and see the caregiver who gives them reassurance, gives them emotional, social education. How does the parent respond to stress? Do they smile? Do they cry? Do they go to the corner and buy a little substance in a bottle? Attachment. If that attachment is strong, the kid can accomplish many things emotionally and throughout life with relationships. But if that attachment is not strong, that kid will, look out! That kid will eventually crash. I was trying to get it to the door. I apologize. That kid will crash, and without a strong attachment, mental, emotional, autistic crises are very hard to recuperate from. So attachment. Pouch, please. Remember the emotions of a child. I'm happy to see you. I can't wait to play with you. Remember the emotions of the parent. Little Jordy would not be at this point if it wasn't for your love. You're doing a great job, especially if they start to tear when you talk about things that might have contributed, such as screen time. Okay, the mental, the M. You're born with a lot of neurons, and those neurons learn, experience, causing synapses, causing learning, okay? Sensory processing. We already talked about long distance versus a short distance. But the most important thing I want to tell you in the mental category of the health pillar, mental, is sleep. 50 to 80% of kids with autism have sleep disturbances, and that's related to DNA that affects neurotransmitters that directly affect sleeping, as well as abdominal discomfort and affecting your REM sleep. Pouch, please teach sleep hygiene to your families. I wish I had $1 for every kid that comes with autism and they have no bedtime and they sleep with an electronic device. Okay, the last health pillar, spiritual. The most important thing about the spiritual health pillar is resilience. The studies, the research, the meta-analysis, scientific, biological, not just theological, shows that spirituality for mental health and autism gives resilience. And this is very important. Research indicate that the spirituality, for example, person with autism can relate to a bodiless, a faceless entity and get some understanding of life, meaning, and purpose, because if you can't see the person's face, you don't have to interpret the 1,000 signals that come just from your eyes in social skills. You don't have to worry about gestures. What does this mean? What does this mean? These are just snapshots from websites of all of our trusted organizations, CDC, NIH, Oklahoma State Department of Health. They all have dedicated websites and landing pages for spiritual and faith-based opportunities that help in mental illness. TRADOC, training. Who's been in the military here? Do you remember this? TRADOC, the training doctrine. This is the blue book for basic training. It has a chapter on spiritual health pillar. Faith. There are chaplains in the military. Why? They want their soldiers to be resilient. Your buddy just gets shot. You keep going forward. You just lost an arm. You stay on your task. Resilience is the most important thing with the spiritual health pillar. These are just studies that indicate the spirituality with resilience and how it helps with autism. This one is impressive. These represent suicidality rates. Look how they plummet down when you have more resilience on that bottom axis. More resilience, decreased suicidality. And please notice the top one represents peer victimization, the blue one. So bullies, people making fun of you, people teasing you about your disorder. Higher suicide rate overall, but still decreases with resilience. Pouch, please. The spiritual health pillar is, according to industry standards, is an important health pillar. Break time. I'm almost done. I don't want anybody falling asleep. Where's my assistant? Okay, let's see. Who here has a surgical device on your person? Raise it up. Let me see it. Surgical device. There's one right there, Cannon. See that hand? Go over there. Who else? I see a hand over here. Keep your hand up. The lady with the green sleeve. Adults with autism. Quality of life for adults with autism are related to these three factors. See that lady with the green sleeve? These three things, occupation, friendships, and independent living. These are the three things that adults that all research, meta-analysis, and review of articles use to indicate the quality of life for adults with autism. Long-term factors have also been studied. And I just want to point out one for the sake of time. Greater maternal age and average nonverbal skills by 3. Remember, going back to the screen time, these are determinants long-term for adults. Pouch, please. Each patient you see comes to you representing 100 years of genetics, adverse childhood events, and lifestyle. You're not just looking at that person isolated in time or symptoms. They have all of these, and you have to consider that. Now we're going to do the bare essentials, BEAR, for adults. Become aware, equip your team, and for a visual cue, I want you to think of a bear, okay? Become aware, equip your team, accommodate everyone, reap the benefits. Here's the very first letter, B. Become aware. You have to become aware. Don't come any further. There's tools on the floor. Just stand right here. Thank you very much. You have to become aware that there are autism consultants who work with employers to get jobs for people with autism. You have to be aware that 95% of all adults in the US are unemployed with autism. You have to be aware of the current conversation. I'm only going to point one out. Do you say autistic person or person with autism? It has totally different meaning, and you have to respect the person you're addressing. Person first or identity first? That's the conversation. As well as all of the other conversations, I want you to look up on YouTube, on social media, and review the literature. You have to be aware of your local numbers and community. Remember, these are all stats that are delayed. You also have to be aware that adults burn out with autism. Why? Decades, years, a lifetime of fake living, of camouflaging, of pretending that they don't want to do this to make them happy and relax themselves. So they'll do this. That's stressful. Have you ever tried to be somebody else? How long did you last? Burnout. You have to look for burnout in the adults. The E is for equip the team. HR departments have to get rid of interviews. What do you do in an interview? You shake hands, you smile, you conversate, you laugh at jokes that aren't funny because you want to get the job. The E, equip the teams with substitutions for the interview. Task-oriented evaluations, pre-recorded statements. Let the person with autism lead the interview. Don't try to sit next to them. Don't force them to shake your hand. The technology is also important in equipment. Research indicates that multiple screens, an air mouse like this, these things make you more productive. Here is the curve for, what does EHR stand for? Easy, happy rodeo. But that only happens after months of working with the EHR specialists, implementing it, practicing. When I started my EHR with autism, it would take me 25 clicks. I counted them just to put in the name, date of birth, and primary doctor. Now it's down to 3 clicks because of EHR. I used to use 20 pages when I did my ADOS to diagnose kids, 20 pages. Now it's down to 5, thanks to EHR. So do your EHR. This is a graph I pulled up from a world-renowned consulting company. They talked to a bunch of executives, a bunch of EHR experts, and some government agencies. What are the top categories of decisions for getting an EHR? It is communication with telehealth, online appointments, virtual registration. Where is the ease of use for the nurse and the doctors? It's down here at the bottom, 1% to 2%. Pouch, please. List your dream features. Get involved with EHR from the start. Program it, customize it, learn the shortcuts, get the phone. I hope there's no reps here from EHR. Get the EHR, whoever's coming to give you the EHR, get their phone number or email. They can help you customize it. All right. A in bear, accommodate everyone. This is King William's toilet from 1600. Do you know that before the late 1990s, the federal government said nothing about factories and companies that didn't allow you to go to the bathroom? You had to wait 4 hours until a bathroom break, and people were getting urinary tract infections because they're stuffing paper towels down their pants. The government had to get involved in 1990. What do I need to get my job done? You ask the person, what do you need to get your job done? If you ask me, the first thing I need is a bathroom close to the clinic. But people with autism, if you ask them, they know what they need. They've been doing it their whole life, and it's not expensive. Most of them have their comforting device in their pocket, or they have already purchased that fidget chair or that special screen. They just need permission to bring it to work. Now, the last one, reap the benefits. The research indicates many benefits when autism people enter your job or your environment. R, reap the benefits. I leave you with this list. I'm only going to point out my favorite one. Integrity, honesty, commitment. So which profession has most embezzlement in the research? Doctors' offices, medical offices. So who is more able to steal money out of the cash register? Someone that can creatively lie and manipulate numbers, or someone who is fixated on the protocol, the formula, and the actual physical countable dollars? Okay? That's my favorite one. Pouch, please. Spread the word. Connect autism consultants with employers. Think about full-time autism work, please. Remember, your nursing lives inspire quality healing. They also reassure everyone that caring is still a profession. Thank you very much. It's time for me to go and get some exercise. Woo.